Good morning.
Hello.
Hi guys, how you doing?
Good.
So my name is Chantal. I'll be a nurse this morning. Okay. Before we start, can you tell me what your name, please?
Yeah,
Can I just look at
Madhu.
your eye, Ruben?
Yeah, Madhu Ghosh.
Date of birth?
January 17, 1951.
Okay, that confirms what I have. Okay, while I wash my hands, can you tell me what brings you here today?
So I've been coughing for a few days and I have trouble sleeping at night.
I'm listening. And how long has it been going on for?
Past few days.
Past 2 days.
It's been like a good month or two. I think it's been 2 months actually. Yeah.
That she's been coughing at night?
Yes. And she needs multiple pillows.
How many pillows?
3. Two or 3 pillows.
Okay. Anything else that's going on?
I have to get up during the night to pee. 3-4 times I get up.
She almost fell the other day.
Wow, that's serious. Do you feel dizzy, anything like that? Shortness
Yeah,
of breath?
sometime.
Okay. Are you on any medications right now?
No.
She's prescribed them, but she just doesn't take them.
Have you seen a doctor for this condition before?
Not recently. She went a few years ago for an exam and she just never went back to follow up and get the results.
Any other medical issues that's going on I need to know about?
She has hypertension.
Okay, and how do you eat?
So lately I'm not cooking, so I'm ordering food outside, whichever is convenient.
So the last 24 hours, can you tell me what you eat? What did you have in the last 24 hours?
I think last night I ordered pizza, and then during the breakfast I had McDonald's.
You McDonald's for breakfast?
Yeah.
What did you have?
I don't remember. I think
She
I
had
had
a McMuffin.
McMuffin, yes.
With hotcakes, bacon, and sausage and eggs.
Loaded. Okay.
With extra syrup.
Ooh.
She likes her syrup.
Who do you live with?
I live alone.
My sister and I, we tried to come in during the week, but like we both have busy schedules, so we do the best we can, but when she's by herself.
Okay. So let me just check you, listen to your lungs and everything, and then we call the doctor in, okay? Miss Madhu, I'm going to do an assessment on you. I'm going to do your blood pressure first, okay?
Hey Mom, how's your breathing?
It's good. I still have trouble breathing.
Right now, how you feel?
It's same. I'm not coughing right now, but when I go to sleep, I do cough.
Okay. Okay, so your blood pressure is 150 over 92, okay? Which is a bit on the high side. Alright? Let's check your pulse.
What's the normal blood pressure?
Well, it should be anywhere from 120 over 80. But being that you have a history of hypertension, I mean, we're concerned, but let's see what the doctor says. We're just going to check your pulse, okay? Okay. Just going to look at your chest for a minute. Okay, your breathing is a little bit fast. Alright, let me check this into your lung. Your heart as well. Breathe in for me. Okay.
Is she okay?
Breathe in. Again. Could you lay back for me a little bit? Can you turn to watch the finger daughter for me? You can sit up. So I hear a bit of crackles in your lung. So there is some fluid build up there in your lung. Okay? So we're gonna call the doctor in and see what he says, okay?
What would be the cause of that?
There could be many causes of that. A lot of different things. I cannot give you a diagnosis. The doctor needs to tell you more about what could cause that.
What do the crackles mean?
That there's fluid in the lungs. Okay? That's the reason why probably you peeing a lot and you can't sleep with your head flat and it's causing the excess breathing. Okay? Let me just get the doctor.
Thank you.
You're welcome. Hello, Dr. Adam.
Yes.
So I have a patient here, Miss Madhu, 85-year-old female patient. She's here with her 2 daughters.
Okay.
She's complaining of frequent cough, peeing
Okay.
at night, sleeping on 3 pillows. It's been going on for a while. She's been to the doctor.
Okay.
She had an echocardiogram done and she didn't take any meds or do any follow-up right now, but now it's getting up where it's bothering her.
Okay.
Vital signs, blood pressure 150/92, respirations at 33, her pulse was 102.
Alright.
She just doesn't have any fever. She's taking the medications at the time, and she's complaining of a little weakness.
Okay.
Okay.
Okay. So
Oh, and
would
she
you like?
also has on assessment. She had crackles in her lungs.
Okay. So would you like me to go in and speak to the patient?
Sure,
Okay.
I'll
Sounds
follow you. Hi, Miss Marisha, I'm your nurse. I'm here with Dr. Adam. Okay.
Hello, Miss Madhu. So I'm over here and I'm reviewing your chart, and it says that the chest ray you did on admission revealed left ventricular hypertrophy, and your current echo eval shows a regurgitation jet
Can you
velocity.
slow down?
Okay, and shows a dilated left ventricle.
What does that mean?
Okay, so that means that you have congestive heart failure.
Am I dying now?
You're not dying, but I will be placing you on a medication called Digoxin. And this medication is used to treat heart failure, and it will increase the force of myocardial contraction, okay? This medication prolongs the refractory period of the AV node and decreases conduction through the SA and AV nodes, okay?
Dr. Adam, the
Yes.
daughters has some questions.
Yes.
I'm sorry.
Is she gonna be okay?
Seems pretty serious.
Is the digoxin a cure?
It's not a cure, but it will treat and manage.
I mean, is she gonna be able to afford it? Because her insurance, like,
Her insurance should cover it, yes.
Do I have to take this medicine?
You have to take this medication every day as prescribed.
Yes.
If you miss more than 2 doses, you're gonna call your doctor. Okay?
Okay.
If at any point you feel any abdominal pain, nausea, vomiting, you okay?
Yeah.
Okay. Vomiting, nausea, abdominal pain, blurred vision. If you notice that your heart rate is a little bit slowing down, you don't feel well, please call
is she
Dr.
gonna be able?
Adam.
Like, I don't think she's gonna be able to remember all that. Like, do you have any?
Are the side effects
information?
even worth her taking the medication?
No, every drug has a side effect. It doesn't mean it's going to happen. It may not happen, but if in case you observe this, please call the doctor.
Do you have like an information? Like,
Sure, I will
booklet
give
or
you that.
pamphlet?
Sure. One
She's very
second.
forgetful.
Sure. So you could keep this. I'll give you that one, and you can also keep that one. And you know, please make sure that she's compliant with the meds. Please take it every day at the same time. Do not leave it next to the window. It's very sunlight sensitive, so make sure you keep it somewhere that's stored. Okay? Any side effects, nausea, vomiting, belly, blurred vision, please call the doctor.
What if
Okay.
what if she takes too much of it, or what's gonna happen if she
So
takes too much?
if she takes too much, she's gonna have this called something that's called ditch toxicity. So she's gonna have abdominal pains, vomiting, nausea, blurred vision. She's gonna have something called bradycardia. Her heart is gonna slow down. So if you observe any of this right away, call the doctor, go to the emergency room. Then we have to do blood work to see how the levels are of the ditch in her.
So how do we know what the toxicity levels are for digoxin?
We're gonna do blood work. She's gonna come in either periodically for blood work. We want it to be anywhere below 0.5 to 2.0. If it's above 2.0, then this calls for concern. That's ditch toxicity.
Okay, so I'm gonna prescribe a one-time dose and then gradually increase the dosage from there until the therapeutic level is reached, okay? Okay, guys, oh, I'm getting paged right now.
Thank
see
you,
you
Dr.
later.
Adam. We'll see you around.
Thank
Alright.
you.
Thank you, guys, hope you feel better.
Miss Madu, the doctor prescribed you digoxin. So I'll go over with you one more time what digoxin is. Digoxin is going to control your heart rate. Okay, you have congestive heart failure. You have fluid in your lungs. Digoxin is going to help you to breathe better and hopefully you have better nights when you sleep. You take digoxin every day at the same time. You also want to check your weight daily. We need to monitor your fluid. You cannot drink too much water, so at least 1 liter per day until everything subsides. Now before you take the digoxin, you make sure you check your pulse.
How do I do that?
Alright, you're gonna go to any of your local pharmacy and get this.
What is this?
It's called a pulse oximeter. Okay? And this is how you use it. I'm gonna show you how to use it. You're gonna put your index finger, I'll show you.
Is she gonna be able to, can her insurance cover it? 'Cause-
Yes.
Okay.
And it's only like $10. It's not much. And you wanna make sure it's it's at 60 and above. If it's below 60, you do not take the digoxin. That's fine. Yeah. Yeah. Keep your arrangements. Remember what's going on. I also want to check your weights daily. Okay. All right. So I'm gonna give you a dose of the medication right now.
To buy her
Is that okay with
scale.
you? I'm sorry.
We'd have to buy her a scale. She doesn't have one at home.
Okay. All right. Do that and make sure you record the weight and the time and everything that you took the weight. But I do it in the morning. Okay.
Okay.
So I have a dose here for you. I think you prescribed 1 pill 2 times a day. Just make sure you take it at the same time every day.
Like every 12 hours, basically.
Right. Can you verify your name and last name for me?
Yeah, Madhu Ghosh. What else?
Date of birth?
January 17, 1951.
Okay, can I get your ID card as well? Pretty much is what I have. Okay, so I have the digoxin here for you. Let me just check your pulse before you get the medication, okay? You could do it manually as well. And you come, hold 1 second. Let me just, so you could do it just in case you know you don't get. So you find your pulse here. Take this off. Use your 2 fingers. Okay? And you're gonna count for a full minute. Okay? So we're looking at 73. I'm sorry, you said something?
It seems like a lot for her to remember on her own.
So that's why I suggest using the pulse oximeter. It's very
And that's the
easier
same
to
thing
use.
as what you
It's the
use.
same thing. This is just manually. So if you guys don't have this and you here, you could do that. But this is maybe better and easier for you to do.
We'll pick it up on the way home.
Okay, great. So here's the digoxin. And here's some water. Okay?
Can I get some cold water?
You want cold water instead?
Yeah.
Okay, sure. 1 second.
What time is it? Because she has to take it. So it's 12:50. So she would have to take
Right.
it. Okay.
Okay. All right, Miss Madhu. I hope you feel better. Take care of yourself, and please also consider changing your diet changes. So we don't want you doing McDonald's anymore. Some salad, you know, fruits and vegetables, and try to walk a little bit, at least 40 minutes every day. That's gonna help exercise your lungs, and restrict your fluids to at least 1 liter a day. Okay, and then you should feel better. You're gonna follow up in like about a month, and we'll call you to remind you of a follow-up appointment. If anything, please reach out to us or call Dr. Adam. Okay, I'll give you his card.
Okay.
Okay,
Thank
Thank
you.
you.